Hello dear patients. Today we are going to discuss the patient who came to us with red spots on glans penis. For many times already he had been to dermatovenerologic dispensary and he was set a diagnosis of candida of glans penis. He applied layers of clotrimazol ointment. He tried other anti-fungal ointments. He had tons of fluconazole. However, there was no result. Apart from that, the patient suffered from diabetis mellitus. I repeat that there was no improvement secondary to treatment. He had been to almost 4 doctors of dermatovenerologic dispensary, and he got almost the same results aimed at fighting with non-existing candida. There is a method of treatment called juvantibus, meaning a trial treatment. If there is no opportunity to do expensive diagnoses, and if trial treatment doesn't help, then such diagnosis is normally rejected. However, persistent doctors didn't want to reject a diagnosis of candidosis of glans penis. However, after analysis including PCR for 8 candida, culture test for candida, it was found out that there is no candidosis on glans penis. However, the reddenings were there. Analysis for bacteria were also taken. However, there was a common epidermal staphylococcus there in a normal concentration. This is not surprising considering the number of ointments he used on a regular basis. Later on, blood analyses were taken. At that particular moment, the excess of sugar volume was quite insignificant, about 6.5, which is an upper limit of normal. After that, analyses were taken for allergy and an increased immunoglobulin E was found in about 2 times, and eosinophils were also increased. The patient was referred to allergologist consultation, where food intolerance for particular products was found, etc. We are not going to talk about it now. So an external anti-inflammatory treatment was prescribed to him. Sodium thiosulfate, calcium gluconate were prescribed, as well as corresponding diets, immunological treatment. As a result of that, these rashes completely resolved. So this case indicates that you shouldn't treat candidosis with a fanatic confidence, particularly when there are no positive results from the use of antifungal medications. Examination has to be done together with corresponding treatment, particularly if the previous treatment doesn't help. That means that the diagnosis is clearly not candidosis. I repeat that there are many diseases that induce redness on glans penis, and that was the case here. If there are any rashes in the area of sexual organs, you can consult dermatologists, venerologists and urologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.